Welcome to the Illinois Primary Healthcare Association's Health Talks podcast. On this podcast, we highlight incredible individuals who advance community healthcare, advocacy, and public health while striving to improve patient care.
Well, welcome today to our Immunization podcast. We're here today with Dr. Samir Vohra with the Illinois Department of Public Health. And we're also here with Melissa Graven with the Illinois Public Health Association as the Immunize Illinois Coalition Manager. We're here today to take a closer look at the current state of immunizations in Illinois, especially as federal policies continue to evolve. With changes to immunization schedules and increased media attention, there is also a growing wave of misinformation, creating confusion for both patients and providers. Our conversation today will focus on what is changing, how Illinois is responding, and what providers need to know to continue protecting public health. To start us off today, I'd like to ask Dr. Vohra, what have been some of the biggest developments in immunizations over the past year, particularly from the Illinois Department of Public Health?
Well, Paula, thanks so much for having me on the Health Talks podcast. And as you mentioned during this intro, it's been a big change around standard immunization processes coming from the federal government. What we saw really in June 2025, the HHS Secretary, Robert F. Kennedy Jr., removed all 17 members of the Advisory Committee on Immunization Practices, which was the gold standard committee in which providers, public health practitioners received guidance around immunization recommendations. What then followed was that new advisory committee dramatically deviated from past practices and had significant changes that were not supported by the full weight of scientific evidence. And that's a place where the Illinois Department of Public Health felt that we had to step in to create the credible, transparent, science-based information that our public needed. We bolstered our Illinois Immunization Advisory Committee. Paula, a place where thank you for your membership on that committee, and really worked to get our residents science-based information around first, the fall respiratory season immunizations, and then subsequently adopted the American Academy of Pediatrics guidelines around the child and adolescent immunization schedule because we saw big deviations from the HHS Secretary on that as well.
Thank you so much. Is there anything you'd like to add to that, Melissa?
I really want to applaud IDPH and Dr. Vohra for their advocacy and efforts in getting that respiratory guidance out early and quickly. It really helped provide a lot of clarity to providers in the community on what does this mean for me? I'm hearing all these changes at the federal level to have that guidance and documentation and that advocacy early was incredibly beneficial, impactful, and probably allowed a lot more people to get their respiratory vaccines earlier than they might have put them off not knowing what should I get and when should I get it.
There has been a lot of attention on schedule updates. Dr. Vohra, can you talk us through what the state is currently doing to guide immunization efforts, including the 2026 childhood and adult immunization schedules?
Yeah, and Melissa, thanks for those kind words. I mean, I think we have felt that, again, our responsibility, because a lot of confusion out there, and much of it is that we do want to be aligned as the public health and medical communities. That alignment has to be based on the full weight of scientific evidence. And Paula, as you mentioned, what also changed in January of this year is that the federal government, without that deliberate scientific process, altered the child and adolescent immunization schedule, reducing the number of diseases targeted from 17 to 11, and then the number of routine vaccines from 13 to 7. And so this meant that 6 vaccines were no longer recommended for routine use by all children in the U.S. Diseases like rotavirus, COVID-19, influenza, hepatitis A, and hepatitis B, as well as meningococcal vaccines. Vaccines that we know have prevented diseases and morbidity and mortality across Illinois, across the country, and across the world. And that's why it was important for us to once again convene our Illinois Immunization Advisory Committee to go through the science, think about what other organizations had been offering, and ultimately came to the conclusion that the American Academy of Pediatrics Child and Adolescent Immunization Schedule was one that we felt important and comfortable endorsing. Schedule that I'll add, which was also endorsed by a dozen leading national medical associations across the country, from the American Medical Association to the American College of Obstetrics and Gynecologists as well.
I think I would like to add that we need those experts at the state level to go and shift through the science, right? We want those experts to look and evaluate and assess that information. And as the coalition, we want to support that and then turn around and run with that message throughout the state of Illinois. Because of all the changing recommendations and guidelines and what are we supposed to do, we want to hold up the experts in the field that we have in our state and point to them as who we can go to for guidance, for information. And really the coalition is here to help support that and make sure that message and that trust, we can identify trusted messengers in the community to continue that messaging and share the importance of vaccines in their community.
Dr. Vohra, for providers listening today, what should they know about Illinois' Immunization Advisory Committee and any recent vaccine-related legislation that may affect their work?
As we saw the changes that were coming from the federal government, we already had the ability here in Illinois that we had a separate Illinois Immunization Advisory Committee. Now, as we mentioned previously, there wasn't a lot of disagreement between what the federal government through the Advisory Committee of Immunization Practices was recommending to what was being recommended by our Illinois Immunization Advisory Committee. And that was an important committee where we talked about ways to improve our education campaigns, talk about some of the latest information. What these federal changes necessitated, though, is that we wanted to, in many ways, reconfigure the approach of how the committee was practicing, really taking into account an evidence to recommendation framework, because now we felt that it would be really important for us to have the kind of recommendations that were necessary for our residents and our providers. And we wanted to ensure that we are very fortunate in this state that we have some of the world's leading experts, as Melissa mentioned, in things like infectious disease, immunology, obstetrics, gynecology, pediatrics. We also know that we're a big, diverse state, and really important to have that understanding of how the information and the data corresponds to the stories on the ground. And so we made a big effort to bolster that committee with the kinds of representation that we wanted so that we would feel comfortable, and I would feel comfortable, that when those recommendations were being made, that to endorse them, I was putting the best interest of the residents at heart. So we made those changes, but we also knew that in order to codify them into law, that would give the ability of the Illinois Immunization Advisory Committee and the Department of Public Health the power to not just issue this guidance, but have our state regulated health insurance companies endorse that guidance, we would need legislative change. And so under Public Act 1040439, this was House Bill 767, which was signed in law by Governor Pritzker on December 2nd, 2025, it did empower the Illinois Department of Public Health to issue this transparent, science-based vaccine guidance through recommendations of the Illinois Immunization Advisory Committee. We know that science is not static and that it may change. And so this is not sort of a pushback against change. It's a pushback to have the types of experts that are reviewing the science, both in their careers and then applying them on the state side, while also doing it in a public way that allows people to understand the conversation and to understand the basis in which we, as the Illinois Department of Public Health, are making those recommendations.
As we've seen the changes at the IDPH level, we've also seen new partnerships emerge. Melissa, can you share more about the new Immunize Illinois Coalition and how it complements and strengthens the work already being led by the Illinois Department of Public Health?
Oh, I would love to. Thank you for giving me the opportunity. I will always talk about Immunize Illinois Coalition. Happy to do that. The coalition is relatively new, and we're really trying to gain statewide partners to ensure reliable, sustainable, and equitable pathways to immunizations across the lifespan for all Illinoisans. So we're really working to cultivate relationships from the very top of the state to the very bottom of the state, because we know vaccine access and equity looks much different in the Chicago area than it's going to look in, Southern 7. So our work right now is to identify those partners, identify those advocates, identify those agencies who are willing to partner and continue advocating on how we can ensure vaccines in their community. The coalition is doing that through a lot of different avenues and ways. I think right now our biggest hurdle is how do we combat vaccine misinformation and disinformation, right? It's hard to get somebody to want to even go get a vaccine if they are hearing all this chatter and all this conversations around vaccines. So one way we're trying to do that is by providing good, reliable, credible information that's put out by Illinois Department of Public Health and the, Illinois Immunization Advisory Committee. We want to make sure we're amplifying their message in a clear and concise way. We know talking science isn't always fun. I should say it's fun for us who like to talk science. It can't always be clear and concise. So we're really working hard to find ways that we can convey that information that's relatable to the community we're trying to get the information to. We've been doing a 3-part vaccine immunization education series with Gloria Barrera that really speaks to community health workers and how you as a person in your community can understand what's happening with vaccine misinformation and disinformation and how you can have that conversation with your neighbors, with your family, with friends on some of the information or some of the misinformations that they're hearing in their community and how they can counter that in a non-aggressive way, like really meeting people where they are, because it's okay to have questions about vaccines. You should absolutely question any medical decision you're going to make for yourself or your child or your family member. But it's just making sure you have access to the right information and the good information to balance out all that you're hearing that isn't always the best information.
With access remaining such an important issue, is there any additional efforts that you'd like to expand on, especially in communities experiencing health inequities?
Absolutely. And we know that even when we have the best information out there, when it's not matched with the types of access that allows individuals to get these kinds of different vaccines, that can be another barrier. And so one of the things that we also launched at the Illinois Department of Public Health in late 2025 was the Illinois Vaccine Access Program, led by our immunization division. Karen Lyons, our chief there, along with partnerships across our local health departments, was really a state-funded initiative that allows those local health departments with the option of directly ordering certain vaccines at no cost for Illinoisans who may otherwise lack access. Now, we started with COVID-19 vaccines important during the respiratory season, but we also have wanted to figure out different ways to expand that. One program that related to that has been working with mobile care units and a provider to use mobile vans to get measles vaccination rates up as well. We know that in 2026, there have been almost 1,600 measles cases in the first 3 months of the year. Now, this coming after a 2025 when we had more measles cases across the country than in the last 25 plus years. We've been fortunate, though, in Illinois. Last year, we only had 14 cases. And up to this point, we've only had 4 cases. Doesn't mean that we're not going to have more cases moving forward, but a lot of this has been a deliberate effort to match the guidance, match the positive education campaigns, as Melissa said, the importance of partnerships with the kind of access programs to get people the important vaccinations that they need. We're not fully sure what this is going to look like on the federal level, and doing our best to build the kind of foundational needs that our residents should have and need to have here in Illinois.
Dr. Vohra, a term that's coming up more often is shared clinical decision making. For our listeners who may be less familiar, what does that mean in practice, and why is it especially important right now?
Well, what we've seen is a shift, and sometimes it is confusing because there's often a lot of conversations that, well, vaccines should be about shared decision making between providers and their patients. As a general pediatrician and having clinics throughout my career in the south side of Chicago as well as in Springfield, Illinois, I would say that we always want to be in a position around shared clinical decision making because every patient has every right for themselves and their children to make the kinds of healthcare decisions that are the right ones for themselves and their families. That's a core component of how we practice medicine in the United States, and ones that every physician through medical school understands that this is part of that decision-making process. However, that doesn't take away the fact that there are certain things that, as a general pediatrician or now as the director of the Illinois Department of Public Health, we would make as recommendations for the best aspect of medical care, taking in the full weight of scientific evidence. There are things throughout, from different screening tests, different vaccinations, that we know the science supports, so we recommend them. What shared clinical decision making is that sometimes there is wiggle room. And that's often a place where, as a pediatrician or as an adult provider, you would say, well, we could order this test in our 40s, or we could wait till 45, and there's wiggle room to have that shared clinical decision making. But vaccines and the importance of vaccines are recommendations because we feel confident in how the science supports that, and how we know from both individual information and population level studies how that improves health and improves the care of individuals, their families, and communities. And so I want to kind of just maybe reassess and kind of like emphasize that point. We're always in a place where we're supporting the decisions of families as healthcare providers. But there are places where it's that much more important to make recommendations when the science supports it. And so that's areas in which the federal government has shifted, moving from recommendation to shared clinical decision making. We here in Illinois, and through the work of the Illinois Department of Public Health and the Illinois Immunization Advisory Committee, are holding true to that language of recommending vaccines to the general public, ones that are supported by scientific evidence.
Melissa, is the Immunize Illinois Coalition helping to support and share information around the shared clinical decision making as well?
Yes, shared clinical decision making is often a topic that we get lots of questions here about in terms of practice, especially with a lot of the local health departments we work with. What does that mean? As a nurse, can I participate in shared clinical decision making? So we've tried to do a lot of education to those providers about what that means. And often I hear shared clinical decision making wrapped up and interchangeably used with informed consent, which we know we are always providing informed consent to our patients or clients that are accessing services. And just to touch on what Dr. Vohra has said, shared clinical decision making allows that recommendation to come from outside of what the guideline says is guidance or recommendations, right? It allows you to have that individual choice and discussion with your doctor about what's best for you. So even though it might say the guidelines and recommendations of that the guidelines say only this age should get it, it should be a conversation with your doctor in your unique perspective, in your unique history, to make that decision with them, with your medical provider or your healthcare provider on what's best for you. So, yes, we do a lot of work around shared clinical decision making, how that conversation can look, and what the intention of it really is.
And I think it's a place where we want to encourage
Yep.
our patients to ask those questions.
hmm
And Melissa said earlier in the podcast, the whole way that we get to a place where people understand is by asking questions. As a dad myself of two kind of growing girls, there's a lot of questions that are natural. And I think for me, both as a general pediatrician and the public health director of the state, we can't get to understanding and trust building without those questions being answered and also being honest about how maybe recommendations may change moving forward. I think that's something that we should all really lean into, ensuring that people have the space to ask the questions that they need. It's the only way we're going to get to a spot where we're building back the trust that's necessary to get us into a spot where public health at times no longer feels under pressure or being pushed back against in the way that it has been over the last few years.
Well, engaging with providers as a patient, I think, is one of the best ways for patients to get correct information. But as we hear, there's a lot of misinformation that continues to be a major challenge for both, community members and patients. What are the most common ways you're seeing misinformation spread, and what impact is it having on both patients and providers?
Yeah, so misinformation is it's like wildfire, right? It's almost like you have to combat it with seven truths or seven times of somebody having to hear it before it finally leaves that person's mind. But I think where we're seeing the most amount of misinformation spread is social media platforms online, that it can be a harbinger of telephone, tell a friend, and it multiplies 14 different ways. What's interesting about misinformation is that it usually is centered on a kernel of truth. There is some aspect of that misinformation that there's some truth in it, but it's been altered or it's been edited to fit the narrative or be framed to align with the rhetoric that might be being shared on that various platform. Like Dr. Vohra said, you should ask your provider questions. And I think it's really important. I just want to keep building on that the only way we're going to combat that misinformation is meeting the clients and patients where they are and answering their questions and not dodging or not. And I know no providers are doing this because I say so, and that's the way we've always done it. I know that's not happening, but being understanding that it's going to take a little more time. It's going to be a longer conversation that we probably have historically been used to having. And I really see the coalition being a place that we can help foster those conversations. So by the time they get to their doctor's office, they're asking questions from a place of, I just need to be affirmed. I just need to know the data. I just need to know the statistics. And we've tried to take care of some of those big misconceptions, misinformations, and quite frankly, intentional disinformation that we're seeing circulate through our media and social media platforms.
And, social media, I mean, it gets all of us, right, in different ways, because you're just like, there, to Melissa's, I think, great point, there's often these like kernels of truth. I think we're all with our own cultures and upbringings. For me, being a member of the Indian community, there were things that my grandma would say, which were kind of the gospel, right? I think what's important for us when we make recommendations as state health authority is that how do we combine what is being said or even sometimes personal practice with the scientific data that supports it. And I think we've been, especially on immunizations, things that have been studied for decades, population level kind of meta studies. And sometimes, and Melissa made this great point earlier too, is that we gotta not so much describe it as the scientist or in the doctor language, and instead just sort of make it real for our patients. And that is something that isn't always easy because when you talk in confidence intervals and p ratios, those are things that like would make my patients fall asleep and sometimes made me fall asleep in medical school as well. But it's really at the core being like, well, this is something that we're doing to really try to prevent an illness that happens. And I think one of the great successes of public health and immunizations is that we don't have the type of vaccine preventable illnesses that we used to have. Things that were so devastating, like polio. I am so thrilled that my girls never have had to go through chicken pox in their youth the way that I had to, and how miserable that was, and how miserable that was for my parents and my siblings who caught that as well. That these are the things that are gifts that we should cherish. And I know sometimes that feels distant because you don't see the problem itself, but those are the result of public health breakthroughs like vaccines.
Well, in my final question for you, we've addressed this slightly, but just to take a moment and maybe expand on, for our clinicians on the front lines, what strategies have been the most effective in building trust and addressing the misinformation?
I will start off with that one. I think motivational interviewing is such an important technique and really can build trust with your client. And those who maybe aren't familiar with motivational interviewing, it's really centering the client at this in the conversation and meeting them where they are. A lot of times, as a nurse myself, you come in with an agenda. You've got to go through your checklist. You've got to do this. You've got to ask your questions. Rather than making it an open-ended conversation, realizing at the end of that conversation, you may not have the outcome that you're anticipating, right? I'm going to tell you all the vaccines that your child might be due for today. This is what they're getting. And allowing space for the questions and meeting where the client is, right? They might say, I still have too many questions. I don't think I'm going to get vaccinated today, but can I come back in a week? And then using that conversation to really start with, okay, I hear you, but where's the concern coming from? What's the most important thing that's giving you anxiety about the vaccine? It's really meeting the client where they are and allowing them to guide a little bit of where that's going to go. Unfortunately, our health systems aren't always set up for that. We're worried that maybe the child won't come back, that the registry is going to show up they're overdue. The parent may not have the ability to get back to the doctor's office. So how are we going to ensure we can get them back? So I think motivational interviewing is such a great technique to meeting where they are and start building that trust with the parent, with the client on vaccine related issues, and having the patience to kind of bear that out and understand our systems might have to change a little bit so that we can rebuild some of that confidence. We're framing this as we're post-COVID 6 years. We have to combat a lot of mistrust that has built in those 6 years through watching the scientific process play out in real time, and people kind of maybe not remembering what that scientific process is, right? Like the hypothesis we have originally don't always bear out. So we have to go back to start and reevaluate our new hypothesis. So we really have to just frame that in. We've got a lot of years of misinformation, disinformation, and hesitancy and mistrust in the medical system, and try to build that back up through our providers, through our coalition, through our partnerships, and making sure that we're the ones that our community is turning to for the good information.
Yeah, I would say ditto to almost all of that. Part of the challenge is, and I think Melissa put it well, is that most of our primary healthcare docs, the nurse practitioners, allied professionals, you are trying to squeeze so much into a very short appointment. And yeah, it's a place where you want to be able to check as many boxes as possible. But I think in much of this work, these are conversations that we have internally in the department too, is that it's a marathon, not a sprint. And it is about trust and authenticity and honesty. I'd say, my career, both in clinical practice, but, even in this job, is that sometimes figuring out ways to correct or improve on statements that you've made, recommendations that you've made, really bond people together. And that
Mhm.
it's a journey to be like, "Oh, Dr. Vohra was right about how to take care of my child," and then allows that to kind of move forward. And one of the big things that we hold as important principles in the department is that we don't recommend things that we wouldn't do for ourselves and our families, because very quick to lose that authenticity and the trust if you're speaking from one side but not following that with actions. And
Mhm.
that's the stuff that's going to build the type of trust. And I thought, Melissa, great point, because it might not happen in just those first 15 minutes, and really ensuring that your patients believe that you have their best interest at
Mhm.
heart. And for all of us, from all of our relationships in life, it doesn't happen in 15 minutes, right? It happens as a journey. And I think this is a really important part of us all across the public health system, from local public health leaders, primary care docs, hospitals, our big, research centers, our community-based organizations. We have to work together to ensure that the right information is out there, that we're being honest, we're being authentic, and we're building the right trusted individuals that Melissa mentioned too, that sometimes it isn't going to be the government official. Sometimes it's not even going to be the doctor. Can it be a community health worker? Can it be the right kind of individual that people trust? And we're working at IDPH to figure out that across all different levels, from the right kind of social media messengers, the right kind of community messengers, and obviously partnering with organizations like IPHCA and IPHA to ensure that we're doing all that's possible to build the kind of trust and fuel public health through the power of partnership.
Well, as we wrap up today's discussion, what is the one message you most want providers and community partners across Illinois to take away from today's discussion?
While Dr. Vohra was talking, I was reminded of the KFF, the Kaiser Family Foundation poll that recently came out that showed physicians are still the most trusted messenger related to vaccine information. Providers listening to this podcast, you are still the most trusted individuals that patients want to talk to about vaccines. So leveraging that influence and keeping in mind kind of the conversation we've had today, right? We have to think about the conversation of vaccines just a little bit different, and meeting clients where they are post COVID. I really encourage physicians and nurse practitioners and nurses and community health workers listening to this podcast about how important your influence is, and that maybe spending a few extra moments asking those questions or looking how processes are set up may change the conversation with your client and may change the outcome of the visit of that person getting a vaccine that day. I think is what I'd probably like to part with.
Lean into this idea that this work is a team sport, ensuring that we know it's been a tough 6 years and counting for healthcare professionals, but really knowing how important all of you are, as Melissa mentioned, to really being able to change the trajectory around somebody's health. And immunizations can be a core component of that. So despite some of the different changes that are coming across the federal government, lean into your training, lean into yourself as a human being, and work to make sure that your patients and the greater community has the best health outcomes.
Well, I want to thank you both, Dr. Vohra and Melissa, for joining us today on Health Talks and taking the time to do a deep dive into immunizations in Illinois.
If you enjoyed today's episode, don't forget to like and subscribe on your preferred platform. It helps us reach more listeners and create more content like this.